and that although they are rare, when we all come together, we are strong. With this commemoration, Connecticut joins 4 other state capitals, individuals around the nation, and 64 countries in acknowledging this special day. Rare Disease Day is an annual event. It always occurs on the last day of February each year, and it was first organized in 2008 by the European Patient Organization, or our sister organization, EURDIS. In 2009, EURDIS asked NORD to sponsor the day. In the U.S., NORD has been joined by close to 1,000 partnering organizations, companies, professional societies, and government agencies to celebrate the day, many of whom are here today, and we really thank you for your participation. Individuals observe the day in many different ways. There are some events like this going on. There's also events at any age, and a lot happens virtually as well. And there's a lot that you can see and do if you go to rarediseaseday.us, and you can learn more about other things that are happening, including raise your hand photos that have been taken around the country that are really great to look at. It's also a very special day this year because it's the 30th anniversary of the Orphan Drug Act, a historic piece of legislation that was signed by law by President Reagan in 1983. This law encourages the development of orphan products, which are the treatments that treat orphan diseases or rare diseases. And so NORD's very excited to celebrate that milestone and the milestone of our founding, which was also the same year. I have a special message. Well, first of all, for the state, we're so happy that so many of the representatives and senators from the state are here to join us today, and we'll be hearing some remarks shortly from them. We also have a proclamation on the table from the governor declaring that today is the day. So we have official recognition, which I would like to thank the governor's office for, and for Cornelia DeLange Syndrome for getting that together. And I also have a message I want to read from President Obama, who sent this letter to NORD to share with the entire rare disease community. He says, "I send greetings to all those observing Rare Disease Day. As a nation, we share an obligation to ensure the health and well-being of our people. Occasions like Rare Disease Day remind us that we must continue to harness our creativity and ingenuity to remain at the forefront of medical research and innovation. With each new discovery we make today, we not only move closer to building a healthier tomorrow for every American, but we also pave the way for breakthroughs that will save and enrich lives around the world. As you gather to imagine a disease-free world, I wish you all the best. Barack Obama." So with that, I'm going to turn the program over to NORD's genetic counselor, Marsha Lanes, to tell you a little more about rare diseases and how they affect individuals in the country.
Thanks, Todd. Good afternoon, everyone, and thank you so very much for joining us here today. My name is Marsha Lanes, and I'm a genetic counselor on staff with the National Organization for Rare Disorders. NORD, as Ty said, is a nonprofit organization established in Connecticut in 1983 by patient advocates who had previously worked together to successfully enact the Orphan Drug Act. We provide programs in education, advocacy, research, and patient assistance. In the United States, a disease is considered to be rare if it affects fewer than 200,000 Americans. This is the definition specified in the Orphan Drug Act. It is the definition used by the U.S. Food and Drug Administration to determine whether a product may be designated an orphan product, and it is also the definition used by NORD. According to the National Institutes of Health, there are approximately 7,000 rare diseases affecting between 25 and 30 million Americans. Rare diseases include all types of diseases. All but a few types of cancer are rare, and there are also rare neurological and neuromuscular disorders, skin and bone diseases, metabolic and chromosomal disorders, and diseases affecting the heart, lungs, and kidneys. Many rare disorders affect multiple body systems. NORD has a database of more than 1,200 reports with detailed information on specific rare diseases in patient-friendly language, and this is available on our website at www.rarediseases.org. Although each individual rare disease affects fewer than 200,000 people, and some affect only a few hundred or even a few dozen, rare diseases in the aggregate affect approximately 1 in 10 Americans. Many rare disorders are chronic and life-threatening. About 2/3 of rare disorders occur in children, and about 80% are thought to be genetic. NORD works with almost 200 member organizations who promote awareness for specific rare diseases, including 2 in Connecticut. Together, we strive to break down the barriers of isolation experienced by patients and families in the rare disease community and advocate for more research, effective treatments, and access to treatments. Everyone knows someone with a rare disorder. We estimate that approximately 358,000 people in the state of Connecticut are affected by rare diseases. Those affected face significant challenges, including a difficulty obtaining an accurate diagnosis. Individuals with rare diseases often live for years without receiving an accurate diagnosis, and sometimes receive an erroneous diagnosis because of lack of awareness, knowledge, and diagnostic tools for rare diseases. There are also limited treatment options. No treatment option is available for about 95% of rare disorders, and many rare disorders are not being studied by researchers. There is also difficulty in finding physicians and treatment centers with experience in treating a particular rare disease. Once a treatment is identified, it is oftentimes generally more expensive than those for common disorders. And in many cases, there are reimbursement issues, both with private insurance as well as Medicare and Medicaid. We will hear stories today from individual patients and parents about the obstacles they have faced and continue to struggle with. Thank you so much, Connecticut representatives, for this opportunity to raise awareness about the needs of the rare disease community on Rare Disease Day. NORD is available to you as a resource for information about the unmet needs of this vulnerable population.
I'm now going to invite Representative Elizabeth Ritter from the 38th Assembly District.
Thank you very much. Thank you everyone for being here. It's been really great to see this event grow a bit each year and to understand the role that Connecticut has played and the help and the hope for so many people struggling with these diseases that we get from NORD and from the efforts that we've made to try to expand awareness. My guess is that everybody here, one way or another, has struggled with the incredible challenges of dealing with a rare disease. Knowing that of the approximately 7,000 that have been identified, perhaps 200 at this point have known treatment regimes that have been proven to be effective. And understanding that one of the hardest parts about this is that with all of the advances we have in modern medicine today, so often it's treatments that are identified as being not just unusual or rarely used, often called off-label applications of prescription drugs and regimes and various dietary treatment patterns. The next challenge is to be able to either afford them or to finally be able to have them covered by insurance. And it's an incredible, incredible road to have to travel. For the years that I've spent here in the legislature working on the Public Health Committee, few issues have really made a bigger impression on me than listening to the stories, to meeting people and learning about their situations in dealing with rare diseases. It's just very challenging. Proudly, Connecticut is one of the very few, and it's a number like around 14 or 15 states in the country that does mandate help with insurance in dealing with some of these treatments, and we've been able to provide that for some people here. That's something that I'm very proud of. We talk all the time about the burdens that are placed through insurance on keeping it affordable, keeping people in the insurance system, but these things are here for a reason, and there's little better reason that you'll learn from listening to people and understanding what they've gone through when they've suffered with rare diseases. So thank you so much. You got lots of people that tell stories far more capable than I can, and I really am glad to see everyone here today. Thank you.
I'm now going to ask State Senator Kevin Whitkos and from the 8th District, and then Johnson.
over. Thank you and good afternoon, everyone. I had some remarks prepared, but I kind of looked at Lynn's display board, and it said, "Wake up to PANDAS." And PANDAS is a pediatric autoimmune disorder. It's brought on by an infection, basically. For short order, it's called PANDAS. And I want to thank Representative Johnson for having hosted a public hearing in the Public Health Committee yesterday. How I got associated with PANDAS is, well, I don't want to get into the story right now, but it says that wake up to PANDAS. And I think of PANDAS almost as a nightmare. A child goes to bed at night and doesn't wake up the next morning because it's somebody different. It's not somebody that a parent or a caregiver recognizes. They're exhibiting symptoms that they've never done before. Oftentimes they can't walk, they can't talk. Their ability in school have decreased dramatically. A parent brings their child to a doctor, their pediatrician, and the pediatrician doesn't know what to do. They run tests, they're negative, so then they start looking at, well, maybe you're on the autism spectrum disorder, maybe you need psychotropic drugs, maybe you need special education. And all of those are misdiagnoses of what actually is the problem. Well, as we're finding out more so about PANDAS doesn't have to necessarily be managed, but it can be cured. It's one of those rare diseases that can be cured. And I implore the state of Connecticut to harness the power of this building to reach out to everybody that deals with young adolescents, from school nurses to pediatricians to guidance counselors to mental health professionals. Show them what PANDAS is. Let them recognize the signs and symptoms, because so often it's like a support group. When you think, I'm in this all by myself, but you are not alone. Once you start reaching out to other individuals, you realize you're not alone. And people, through their own network and through the World Wide Web, are finding each other. And there is a cure out there. We just have to get that information out to the people. And I am so appreciative of Lynn Johnson, the Executive Director from the PANDAS Resource Network, for flying from her home in Virginia to tell her story to the folks here in Connecticut. So, Lynn.
Thank you, Senator Brookfield. So I'm going to try to talk really loud because I kind of have a soft voice, but I have a lot to say. A little bit about PANDAS, and I'd be happy to share with anybody after these presentations. But PANDAS was discovered in 1994 by a researcher at the National Institute of Health. That's very young in the birth of a disorder such as this. And like I said, PANDAS afflicts these children in their minds. So they might not look sometimes like they have a physical ailment, but there's a lot going on in their lives. As Senator Brookfield said, their lives change overnight. And it is basically when their antibodies, just like a lot of autoimmune disorders, when antibodies attack different parts of the body, like Hashimoto's and antibodies attack the thyroid, and these children, it attacks their basal ganglia area of the brain and causes neuropsychiatric symptoms, local and motor tics, and a list of symptoms that go on. How did I get involved in this? My daughter, Lauren, 3 years ago, went trick-or-treating on Halloween, October 31st, perfectly normal, happy, healthy, proud to say straight A student. We love to brag about our children, but seriously, she was your all-American child, and she woke up the next morning sneezing 25,000 times a day, every day. That's every second of her life while she was awake. And this went on from November 1st of 2009 until middle of February 2010. We had no idea what happened to our daughter. I scoured the internet. I searched for anything that revolved around sneezing, not realizing that this is a horrendous tick disorder. Luckily for us, we ended up in the local media, in the national media, in the worldwide media. Her story was heard. And we were connected with a few doctors in this country that understand and recognize this disorder and know how to treat it. My daughter was treated with a series of antibiotics, and we saw the first great response when she put on half with the right antibiotic. We soon discovered that her immune system was compromised and she required a procedure called IVIG. We did that procedure in the middle of February 2010, and the morning after that procedure, my daughter awoke and she was tick-free. There was no more sneezing, and I'm proud to say that 3 years later, she is a thriving freshman in her high school, looking forward to studying marine biology in college, and that's what inspired me to launch this organization. Like many rare disorders, There's no help out there for you. There was nothing when we went out into Nation 3 years ago. We're going to say that we're Kansas and 2.6 million viewers. I was concerned. I had hundreds of families contact us at that point, saying we don't know what to do. We need support. We need a resource for information. So I'm proud to say that we're almost 3 years new as a nonprofit organization. We have over 5,000 members all across this country, in the state of Connecticut, and all over the world, desperately seeking answers. I'm also proud to say that we have 2 bills in this legislative session that have been introduced to help us further awareness and research. I want to thank Senator Wickhouse for one of them, and Senator Pisco for the other, and Senate Bill 360 and Senate Bill 936. And Representative Johnson and the whole Public Health Committee, who has listened to my story over and over again the last 3 days. I try to change it up a bit so it doesn't bore you. But please learn more about Kansas. Please take a postcard of information. I can't tell you how many people in the last 3 days who've never heard of this disorder, who have seen our postcard and say, I think I know somebody who will be afflicted. This is not going to be a rare disease for long, I guarantee you. Right now we know 25% of children with OCD and Tourette's are most likely pandas, and we estimate 5% of the pediatric population is affected by this disorder, which is twice the current autism rates right now. This is huge, and I'm so glad the state of Connecticut, like I said, is going to learn more about this and help us educate not only people in Connecticut, but the physicians and the support network that we need so these children don't get treated for dangerous psychotropic drugs with appropriate treatment. Again, I appreciate it. Thank you so much.
I would like to invite Representative Susan Johnson up to speak from the 49th District.
Sure. It's so glad to see everybody here, and so glad to know that the people in the legislature are working with the National Organization for Rare Disorders. It's something that I've been familiar with for a long time as an advocate for Medicare beneficiaries back in the 90s. I found NORD, much to my delight, to help me with representing people in Medicare cases before administrative law judges. And then as I went through law school at night, I also began to work as a private lawyer when I finished and became a lawyer. And I found that I was also able to use NORD in my work to help people in their disability claims. There are so many people who are denied Medicaid, Medicare, and disability cases just because they don't have a typical disorder. And being able to use NORD has been a huge help to me in my practice as a lawyer, and before that as a paralegal. And then when I came to the legislature and started working on the Insurance and Real Estate Committee, I was approached by people here with children with pandas, and I sent them immediately over to NORD to get the support that they would need to see whether or not NORD was working on the pandas issue. And I found that they were, and they're here today in full force. So I'm so pleased to have everyone here working on these issues, because it's so important to make sure we get the right diagnosis early, that we get the coverage for people who have the disorders, and that we get that information out to all the docs, because we want to make sure that people in Connecticut are covered and people throughout the country get the right kind of medical attention and the right kind of coverage. So thank you for all the work you do. I have huge appreciation for NORD. Thank you so much.
Representative Miller.
How are you? Good afternoon, and welcome to the Capitol. I'm a big supporter of NORD, and also a state rep, but I also have a disease. I have multiple myeloma. 1990, I was diagnosed with multiple myeloma, and I decided to go to a couple of hospitals here in Connecticut and found out that this is a disease they knew nothing about. And a few transplants that they did, stem cell transplants, they had 50-50 chances. And my doctor had indicated that I had I could get 5 years more of life if I had a stem cell transplant. So I thought New York has the biggest cancer center in the East, so competitive, and they knew nothing about the disease. So I finally opted to go to Little Rock, Arkansas. They have a great German doctor down there who's the world famous multiple myeloma doctor. And I've been going down there for 15 years, so the 5 years that I was given to live, it's been extended to 15. And I'm still around, I have a few little minor problems, but that's nothing really that I'm worried about. I'm still breathing and still functioning, and I'm up here having a good time as a state rep with all these lovely ladies. It's been 15 years, and I can't say enough about it. It's a hospital down in Little Rock. It's a major hospital. They have over 10,000 employees. They come from all over the world for most treatment down there. Europe, from South America, all over the country. And more people. So I encourage people to find out what North is all about, find out what these real diseases are. I did propose a bill for stem cell research about 10 years ago. And as that said to me, Chris Murphy, who was the chairman of the public health, who is now a senator in Washington. So we had a lot of controversy over that bill. I'm Catholic, and I had 3 bishops up here, bishops who testified against the bill. They had Jesuit scientists coming here to testify. It was awful. I went to pieces on the House floor. I just couldn't take it. And finally, the next year, we did get it passed. So Connecticut's on the leading edge of stem cell research. We have great hospitals here, Yale, David, Wellesley, I have a lot of faith in the stuff you're doing with stem cells. I think it's a major change in the medical profession because we all have repair parts in our bodies. They're called stem cells. And we can do hair, eyes, ears, you name it, heart. Put stem cells in your heart. They don't know what they should be, and they become heart stem cells. And people get additional life out of it, on something that before they couldn't. It's just a great thing. I'm a wonderful stem cell guy. It's the greatest thing in the world, and I'm sure that the Russians really getting involved with stem cells now. Again, Connecticut's on the leading edge of this. I hope we can promote some cures for all kinds of diseases. That's my story. Well, thank you very much.